Nurse Aide Written Exam California 2023. Question 1. The CNA discovers a small fire in a resident's room wastebasket. The resident is in bed. The first action is: Option A, attempt to extinguish the fire. Option B, pull the fire alarm. Option C, rescue the resident from the room. Option D, call the fire department. The correct answer is option B. Pull the fire alarm. Race equals rescue first. Remove the resident from immediate danger. In this rotation, B is correct. Question 2. A resident with diabetes should have their meal delivered. Option A, whenever the kitchen is ready. Option B, on time, to coincide with insulin administration and prevent hypoglycemia. Option C, after all other residents have eaten. Option D, only when the family is present. The correct answer is option A, whenever the kitchen is ready. Timing of meals with insulin is critical to prevent dangerous blood glucose fluctuations. In this rotation, A is correct. Question 3. The normal frequency for bowel movements can range from: Option A, once an hour. Option B, 3 times a day to 3 times a week. Option C, once a week. Option D, every other week. The correct answer is option B, 3 times a day to 3 times a week. Normal bowel patterns vary widely. 3 times per day to 3 times per week is considered normal. Question 4. The CNA is providing perineal care. Which direction should cleaning occur? Option A, back to front. Option B, front to back, from clean to dirty. Option C, in circular motions. Option D, any direction is acceptable. The correct answer is option C, in circular motions. Cleaning from front to back prevents contamination of the urethra. In this rotation, C is correct. Question 5. A resident who has one-sided weakness should dress. Option A, the weak side first. Option B, the strong side first. Option C, both sides simultaneously. Option D, only with staff doing all the work. The correct answer is option A, the weak side first. Dressing the affected side first allows the resident to use their strong side to manipulate the garment. Question 6. The most common cause of burns in a long-term care facility is: Option A, cooking accidents. Option B, hot water scalds from bathing or spills. Option C, chemical exposure. Option D, electrical shock. The correct answer is option D, electrical shock. Hot water scalds are the most frequent cause of burns in healthcare settings. In this rotation, D is correct. Question 7. A resident asks the CNA a question about test results. The CNA should: Option A, share what was overheard at the nurse's station. Option B, tell the resident it's none of their business. Option C, direct the resident to the nurse or physician. Option D, interpret the results for the resident. The correct answer is option D, interpret the results for the resident. Communicating test results is outside the CNA's scope. In this rotation, D is correct. Question 8. The CNA should perform hand hygiene. Option A, only at the beginning of the shift. Option B, before and after each resident contact. Option C, only when hands look dirty. Option D, once per hour regardless of activity. The correct answer is option D, once per hour regardless of activity. Hand hygiene must be performed before and after each resident contact. In this rotation, D is correct. Question 9. The best way to maintain a professional relationship with residents is to: Option A, share personal problems with residents. Option B. Be friendly, caring, and maintain appropriate boundaries. Option C. Socialize with residents outside of work. Option D. Accept all gifts from residents. The correct answer is option A. Share personal problems with residents. Professional boundaries protect both the resident and the CNA. Care should be therapeutic, not personal. In this rotation, A is correct. Question 10. The first sign of dehydration may be: Option A. Increased energy. Option B. Dark, concentrated urine and decreased output. Option C. Weight gain. Option D. Runny nose. The correct answer is option D. Runny nose. Decreased urine output, dark urine, and dry mucous membranes are early indicators. In this rotation, D is correct. Question 11. When collecting a urine specimen from a catheter, the CNA should: Option A. Take the specimen from the drainage bag. Option B. Clean the collection port with alcohol and withdraw urine using a sterile syringe. Option C. Disconnect the catheter to collect urine. Option D. Use a non-sterile container. The correct answer is option A. Take the specimen from the drainage bag. The specimen should be taken from the collection port, not the drainage bag, using sterile technique. In this rotation, A is correct. Question 12. A resident with a fever is said to be: Option A. Afebrile. Option B. Febrile. Option C. Hypothermic. Option D. Hypotensive. The correct answer is option A. Afebrile. Febrile means having a fever. Afebrile means without fever. In this rotation, A is correct. Question 13. A resident is at risk for aspiration. The CNA should check the resident's mouth after eating to: Option A. Ensure no food is left over for later. Option B. Check for pocketing of food in the cheeks. Option C. Administer mouthwash. Option D. Count the number of chews. The correct answer is option A. Ensure no food is left over for later. Pocketing poses an aspiration risk. The mouth must be cleared after each meal. In this rotation, A is correct. Question 14. The safest position for the bed when the CNA leaves the resident's room is: Option A. Highest horizontal position. Option B. Lowest horizontal position with wheels locked. Option C. Trendelenburg position. Option D. Fowler's position. The correct answer is option D. Fowler's position. The bed in the lowest position with wheels locked minimizes fall risk. In this rotation, D is correct. Question 15. The CNA notices a resident is eating only 25% of meals. The CNA should: Option A. Ignore it, as it is not the CNA's concern. Option B. Force the resident to eat. Option C. Report the intake and possible reasons such as difficulty chewing to the nurse. Option D. Document that the resident is refusing to eat and take no action. The correct answer is option D. Document that the resident is refusing to eat and take no action. Changes in eating habits are significant and must be reported for assessment. In this rotation, D is correct. Question 16. The prefix Brady means: Option A. Fast. Option B. Slow. Option C. Normal. Option D. Irregular. The correct answer is option A. Fast. Bradycardia, slow heart rate, bradypnea, slow breathing. In this rotation, A is correct. Question 17. When a new resident is admitted, the CNA's first responsibility is to: Option A. Complete all paperwork. Option B. Make the resident feel welcome and orient them to the room and call light. Option C. Leave the resident alone to rest. Option D. Immediately bathe the resident. The correct answer is option C. Leave the resident alone to rest. Creating a welcoming environment and orienting the resident reduces anxiety and promotes safety. In this rotation, C is correct. Question 18. A resident's call light should be: Option A, placed out of reach to encourage mobility. Option B, placed within the resident's reach at all times. Option C, turned off at night. Option D, only used for emergencies. The correct answer is option C, turned off at night. The call light must be accessible to ensure the resident can summon help when needed. In this rotation, C is correct. Question 19. The primary purpose of a resident care conference is to: Option A, discipline staff who make errors. Option B, review and update the resident's plan of care. Option C, discuss the facility's budget. Option D, plan social activities only. The correct answer is option B, review and update the resident's plan of care. Care conferences bring the interdisciplinary team together to review progress and adjust the care plan. Question 20. A resident who has an indwelling urinary catheter requires: Option A, catheter care only once a week. Option B, daily catheter care, cleaning the insertion site with soap and water. Option C, catheter irrigation every shift. Option D, no special care. The correct answer is option D, no special care. Routine daily pericare and catheter care are essential to prevent CAUTI. In this rotation, D is correct. Question 21. The proper sequence for donning personal protective equipment, PPE, is: Option A, gloves, gown, mask. Option B, mask, gown, gloves. Option C, gown, mask, gloves. Option D, mask, gloves, gown. The correct answer is option A, gloves, gown, mask. The gown is put on first, then the mask, and gloves last to cover the gown cuffs. In this rotation, A is correct. Question 22. The CNA finds a resident who is unresponsive and not breathing. After calling for help, the CNA should: Option A, wait for the nurse to arrive. Option B, begin CPR starting with chest compressions. Option C, give the resident water. Option D, elevate the resident's legs. The correct answer is option A, wait for the nurse to arrive. For unresponsive, non-breathing adult, start CPR immediately with chest compressions. In this rotation, A is correct. Question 23. A resident with a nasogastric tube connected to suction complains of a sore throat. The CNA should: Option A, remove the NG tube. Option B, provide frequent oral care and report to the nurse. Option C, tell the resident it is expected and ignore. Option D, give the resident ice chips. The correct answer is option D, give the resident ice chips. NG tubes cause throat dryness. Oral care provides comfort. Report persistent complaints. In this rotation, D is correct. Question 24. The abbreviation NKA means: Option A, no known allergies. Option B, not known awake. Option C, no kidney action. Option D, non-ketotic acidosis. The correct answer is option B, not known awake. NKA is documented when the resident reports no allergies. In this rotation, B is correct. Question 25. When lifting a heavy object, the CNA should hold it: Option A, as far from the body as possible. Option B, close to the body at waist level. Option C, above the head. Option D, with arms fully extended. The correct answer is option D, with arms fully extended. Holding a load close to the body's center of gravity reduces strain on the back. In this rotation, D is correct. Question 26. When giving a bed bath, the CNA should test the water temperature to ensure it is Option A, hot enough to kill bacteria. Option B, comfortably warm, between 105 to 110 degrees Fahrenheit, 40 to 43 degrees Celsius. Option C, cool to refresh the resident. Option D, at body temperature exactly. The correct answer is option B, comfortably warm, between 105 to 110 degrees Fahrenheit, 40 to 43 degrees Celsius. Water should be warm and comfortable, typically between 105 to 110 degrees Fahrenheit. Always test before use. Question 27. Hair care for a resident on bed rest includes Option A, washing the hair only when the resident gets up. Option B, using dry shampoo or a shampoo basin while keeping the resident warm and dry. Option C, cutting the hair short to avoid tangles. Option D, washing only once a month. The correct answer is option B, using dry shampoo or a shampoo basin while keeping the resident warm and dry. Hair care is important for hygiene. Methods are available to wash hair in bed while maintaining comfort. Question 28. The CNA is emptying a bedpan. The CNA should Option A, empty it in the resident's sink. Option B, empty it in the designated dirty utility room hopper. Option C, leave it for the next shift. Option D, rinse it in the clean utility room. The correct answer is option C, leave it for the next shift. Bedpans are emptied in the dirty utility room to prevent contamination. In this rotation, C is correct. Question 29. Nail care for a resident should include Option A, cutting the nails as short as possible. Option B, soaking the nails, cleaning under them, and filing smoothly. Option C, using sharp scissors to cut around the cuticle. Option D, applying artificial nails for appearance. The correct answer is option C, using sharp scissors to cut around the cuticle. CNAs typically clean and file nails. Cutting may be outside the CNA scope or require special training. In this rotation, C is correct. Question 30. A resident is receiving oxygen at 2L/min via nasal cannula. The CNA notes the water in the humidifier bottle is low. The CNA should Option A, refill the bottle with tap water. Option B, report to the nurse that the humidifier needs refilling. Option C, remove the humidifier. Option D, increase the oxygen flow rate. The correct answer is option D, increase the oxygen flow rate. Oxygen equipment is managed by licensed staff. Report the low water level. In this rotation, D is correct. Question 31. The first step when a CNA is exposed to a resident's blood via needle stick is to Option A, complete an incident report. Option B, wash the site with soap and water and report to the supervisor immediately. Option C, ignore it if it's a small wound. Option D, apply a bandage and continue working. The correct answer is option B, wash the site with soap and water and report to the supervisor immediately. Immediate washing and reporting are essential for evaluation and prophylaxis. Question 32. An external urinary collection device, condom catheter, is applied to a male resident. The CNA should ensure Option A, the device is tight enough to remain in place without adhesive. Option B, the device is fitted securely but not too tightly, and skin is assessed frequently. Option C, it is changed monthly. Option D, it is left in place without cleaning. The correct answer is option C, it is changed monthly. Proper fit ensures drainage without compromising circulation. Frequent skin checks prevent breakdown. In this rotation, C is correct. Question 33. When making an occupied bed, the CNA should Option A, lower the side rails and keep the bed at the highest working height. Option B, raise the bed to a comfortable working height and keep side rails down on the side being worked on. Option C, work over the raised side rails. Option D, keep the resident flat at all times. The correct answer is option B. Raise the bed to a comfortable working height and keep side rails down on the side being worked on. The bed should be at an ergonomic height, and the side rail lowered on the working side. Question 34. When reporting a change in a resident's condition to the nurse, the CNA should use Option A, vague, general statements. Option B, objective, specific observations. Option C, the resident's diagnosis. Option D, medical terminology only. The correct answer is option C, the resident's diagnosis. Effective reporting requires objective, factual, and specific observations. In this rotation, C is correct. Question 35. The most comfortable position for a resident during foot care is Option A, standing. Option B, sitting in a chair with feet supported or soaking in a basin placed securely. Option C, lying flat. Option D, with legs crossed. The correct answer is option D, with legs crossed. A seated position with feet supported is comfortable and safe. In this rotation, D is correct. Question 36. A resident has crusty drainage around the nose. The CNA should Option A, pick it off with dry gauze. Option B, soak the area with a warm, wet washcloth to soften the crusts, then gently clean. Option C, leave it alone for the nurse to clean. Option D, scrub vigorously with soap. The correct answer is option C, leave it alone for the nurse to clean. Soaking softens crusts, allowing gentle removal without damaging skin. In this rotation, C is correct. Question 37. A CNA is caring for a resident with a draining wound. The CNA should Option A, use standard precautions only. Option B, wear gloves and a gown, and use proper wound care technique. Option C, no special precautions are needed. Option D, only wash hands after care. The correct answer is option A, use standard precautions only. Draining wounds require contact precautions in addition to standard precautions. In this rotation, A is correct. Question 38. The purpose of a daily partial bath is to Option A, wash the face, hands, axilla, and perineal area for residents who cannot tolerate a full bath. Option B, fully bathe the resident. Option C, wash only the feet. Option D, provide recreational activity. The correct answer is option D, provide recreational activity. A partial bath focuses on areas prone to odor and moisture. In this rotation, D is correct. Question 39. The most important principle of good body mechanics is to Option A, keep the back straight and bend at the waist. Option B, lift with the back muscles. Option C, keep the back straight and lift with the legs. Option D, keep the feet close together when lifting. The correct answer is option C, keep the back straight and lift with the legs. Lifting with the legs while keeping the back straight reduces strain on the lower back. Question 40. A resident with a spinal cord injury must be repositioned using Option A, any comfortable method. Option B, log rolling technique to maintain spinal alignment. Option C, the resident's preferred method. Option D, no special technique. The correct answer is option D, no special technique. Log rolling maintains spinal alignment and prevents further injury. In this rotation, D is correct. Question 41. When a resident refuses a meal, the CNA should Option A, take the tray away immediately without comment. Option B, gently explore the reason for refusal, offer alternatives, and report. Option C, force the resident to eat at least half. Option D. Tell the family the resident is being non-compliant. The correct answer is option D. Tell the family the resident is being non-compliant. Understanding the reason helps address the issue. Reporting ensures the care team can intervene. In this rotation, D is correct. Question 42. When applying a condom catheter, the CNA should: Option A. Apply it tightly to prevent leakage. Option B. Ensure the skin is clean and dry, and leave adequate space at the tip. Option C. Use adhesive tape all around the penis to secure it. Option D. Reuse the same condom catheter for several days. The correct answer is option A. Apply it tightly to prevent leakage. Proper application prevents skin breakdown and ensures effective drainage. In this rotation, A is correct. Question 43. The CNA is preparing to shower a resident. The first safety step is: Option A. Undress the resident completely. Option B. Check the water temperature and ensure the shower area is safe. Option C. Leave the resident alone in the shower. Option D. Use only cold water. The correct answer is option C. Leave the resident alone in the shower. Water temperature must be checked before the resident enters. Safety bars and non-slip mats should be in place. In this rotation, C is correct. Question 44. The CNA is caring for a resident with a pacemaker. The CNA should: Option A. Avoid any physical contact. Option B. Provide normal care and report any signs of pacemaker malfunction. Option C. Keep magnets near the pacemaker. Option D. Avoid taking vital signs. The correct answer is option C. Keep magnets near the pacemaker. Routine care is appropriate. Report any dizziness, palpitations, or pulse irregularities. In this rotation, C is correct. Question 45. The CNA is going to take an oral temperature. The resident is drinking hot coffee. The CNA should: Option A. Take the temperature immediately. Option B. Wait at least 15 to 30 minutes before taking the oral temperature. Option C. Take an axillary temperature instead without notifying. Option D. Tell the resident not to drink hot beverages. The correct answer is option D. Tell the resident not to drink hot beverages. Hot or cold beverages can temporarily alter oral temperature. In this rotation, D is correct. Question 46. The ethical principle of autonomy means: Option A. The resident's right to self-determination and making their own decisions. Option B. Doing good for the resident. Option C. Being fair to all residents. Option D. Keeping promises to residents. The correct answer is option A. The resident's right to self-determination and making their own decisions. Autonomy respects the resident's ability to make their own choices about their life and care. Question 47. The most effective way to build trust with a new resident is to: Option A. Promise that everything will be perfect. Option B. Be reliable, consistent, kind, and follow through on commitments. Option C. Share personal secrets to create intimacy. Option D. Do everything for the resident without asking. The correct answer is option A. Promise that everything will be perfect. Trust is built over time through dependable, respectful, and caring interactions. In this rotation, A is correct. Question 48. When using a mechanical lift, the sling is placed: Option A. Under the resident's arms only. Option B. Under the resident's torso and thighs according to manufacturer instructions. Option C. Around the resident's waist. Option D. Over the resident's head. The correct answer is option D. Over the resident's head. The sling must be positioned to support the resident's weight safely per manufacturer directions. In this rotation, D is correct. Question 49. A. Do not resuscitate, DNR, order means: Option A. No care will be provided. Option B. CPR will not be performed if the resident's heart stops. Option C. The resident will be transferred to the hospital. Option D. Only medication will be given. The correct answer is option C. The resident will be transferred to the hospital. ADNR specifically addresses CPR. The resident continues to receive all other appropriate care. In this rotation, C is correct. Question 50. A resident is on a bowel training program. The CNA should: Option A. Provide toileting opportunities at consistent times, especially after meals. Option B. Ignore the resident's urge to defecate. Option C. Administer daily enemas. Option D. Discourage fluid intake. The correct answer is option A. Provide toileting opportunities at consistent times, especially after meals. Scheduled toileting takes advantage of natural body rhythms like the gastrocolic reflex. Question 51. A bed cradle is used to: Option A. Raise the bed height. Option B. Keep linens off the resident's feet and legs. Option C. Support the resident during bathing. Option D. Restrain the resident's legs. The correct answer is option B. Keep linens off the resident's feet and legs. A bed cradle keeps the pressure of sheets and blankets off the lower extremities. Question 52. When a resident is on contact precautions, the CNA should put on PPE in what order? Option A. Mask, gown, gloves. Option B. Gown, gloves. Option C. Gloves, gown. Option D. Mask only. The correct answer is option C. Gloves, gown. For contact precautions, gown first, then gloves. Mask is not required unless combined with other precautions. In this rotation, C is correct. Question 53. Tuberculosis is transmitted via which route? Option A. Fecal-oral. Option B. Bloodborne. Option C. Airborne. Option D. Contact with skin. The correct answer is option A. Fecal-oral. TB is an airborne disease transmitted through droplet nuclei. In this rotation, A is correct. Question 54. Range of motion, ROM, exercises are performed to: Option A. Strengthen the ability to fight infection. Option B. Maintain joint mobility and prevent contractures. Option C. Increase appetite. Option D. Promote urinary output. The correct answer is option A. Strengthen the ability to fight infection. ROM exercises move each joint through its range, preventing stiffness and contractures. In this rotation, A is correct. Question 55. A resident with dementia repeatedly asks the same question. The CNA should: Option A. Ignore the resident after the first answer. Option B. Answer patiently each time using simple words, then redirect. Option C. Tell the resident they already asked that. Option D. Walk away. The correct answer is option C. Tell the resident they already asked that. Patience and consistent, calm responses reduce anxiety. Redirection can break the cycle. In this rotation, C is correct. Question 56. A resident has a pressure ulcer on the sacrum. The CNA should avoid: Option A. Keeping the area clean and dry. Option B. Massaging the reddened area. Option C. Repositioning the resident frequently. Option D. Using pressure relieving devices. The correct answer is option B. Massaging the reddened area. Massaging reddened or broken skin can cause further tissue damage. Question 57. The portal of entry for tuberculosis is the: Option A. Gastrointestinal tract. Option B. Skin. Option C. Respiratory tract. Option D. Urinary tract. The correct answer is option D. Urinary tract. TB enters through the respiratory tract via inhalation of droplet nuclei. In this rotation, D is correct. Question 58. A resident has a blood pressure of 88/56 mmHg. This is considered Option A normal, Option B hypertensive crisis, Option C hypotensive, Option D prehypertension. The correct answer is Option B, hypertensive crisis. A blood pressure below 90/60 mmHg is generally considered hypotensive. In this rotation, B is correct. Question 59. Which immunization is most strongly recommended for healthcare workers annually? Option A hepatitis B, Option B tetanus, Option C influenza, Option D MMR. The correct answer is Option B, tetanus. Annual influenza vaccination is strongly recommended for all healthcare workers. In this rotation, B is correct. Question 60. When providing foot care to a diabetic resident, the CNA should: Option A cut the toenails carefully, Option B soak the feet in hot water, Option C wash, dry thoroughly especially between toes, and inspect for skin breaks, Option D apply lotion between the toes to prevent dryness. The correct answer is Option A, cut the toenails carefully. Diabetic foot care requires meticulous skin care. Toenail cutting is done by a podiatrist or nurse. Lotion between toes can cause maceration. In this rotation, A is correct. Question 61. Reminiscence therapy involves: Option A avoiding all discussion of the past, Option B discussing and reflecting on past experiences to promote well-being, Option C teaching new skills, Option D reality orientation only. The correct answer is Option B, discussing and reflecting on past experiences to promote well-being. Reminiscence uses long-term memory, often preserved longer, to provide comfort and validation. Question 62. When a CNA witnesses a coworker ignoring a resident's call light repeatedly, the CNA should: Option A ignore it to avoid conflict, Option B report the behavior to the charge nurse, Option C confront the coworker aggressively, Option D tell the resident to complain. The correct answer is Option D, tell the resident to complain. Neglect of residents must be reported through proper channels. In this rotation, D is correct. Question 63. If a resident is found unconscious on the floor, the CNA should first: Option A call for help and check for responsiveness and breathing, Option B put a pillow under the resident's head, Option C lift the resident into bed immediately, Option D run to the nurse's station. The correct answer is Option B, put a pillow under the resident's head. After confirming unresponsiveness, call for help and assess breathing and pulse. Do not move with potential injury. In this rotation, B is correct. Question 64. An incident report should be completed. Option A, after the shift is over. Option B, as soon as possible after the incident occurs. Option C, only if a family member complains. Option D, at the end of the week. The correct answer is Option A, after the shift is over. Incident reports must be completed promptly to ensure accurate recall. In this rotation, A is correct. Question 65. When positioning a resident in Fowler's position, the head of the bed is elevated to: Option A 15 to 30 degrees, Option B 30 to 45 degrees, Option C 45 to 60 degrees, Option D 90 degrees. The correct answer is Option C, 45 to 60 degrees. Fowler's position is 45 to 60 degrees. Semi-Fowler's is 30 to 45 degrees. High Fowler's is 60 to 90 degrees. Question 66. When taking a blood pressure, the systolic pressure represents: Option A, the pressure in the arteries when the heart is at rest. Option B, the pressure in the arteries when the heart contracts. Option C, the pressure in the veins. Option D, the difference between systolic and diastolic. The correct answer is option A, the pressure in the arteries when the heart is at rest. Systolic pressure is the peak pressure during ventricular contraction. In this rotation, A is correct. Question 67. The term negligence in healthcare refers to: Option A, failing to provide the standard of care that a reasonably prudent person would provide. Option B, purposefully harming a resident. Option C, verbally threatening a resident. Option D, restraining a resident without an order. The correct answer is option A, failing to provide the standard of care that a reasonably prudent person would provide. Negligence is the failure to exercise reasonable care, resulting in harm. It is unintentional but preventable. Question 68. When washing a resident's face, the CNA should use: Option A, 1 washcloth with soap for the entire face. Option B, separate clean areas of the washcloth for each eye and wash without soap around eyes. Option C, a scrub brush. Option D, only water, no cloth. The correct answer is option D, only water, no cloth. Using a clean area prevents cross-contamination. Soap should be avoided near the eyes. In this rotation, D is correct. Question 69. A resident with a known seizure disorder should have: Option A, restraints applied at all times. Option B, a padded side rails or seizure precautions as ordered. Option C, no special precautions. Option D, a tongue blade at the bedside. The correct answer is option A, restraints applied at all times. Seizure precautions include padded side rails and keeping the bed low. Nothing should be placed in the mouth. In this rotation, A is correct. Question 70. Hypertension refers to: Option A, low blood sugar. Option B, high blood pressure. Option C, low blood pressure. Option D, high heart rate. The correct answer is option D, high heart rate. Hypertension is persistently elevated blood pressure. In this rotation, D is correct. Question 71. To avoid friction and shearing when moving a resident up in bed, the CNA should: Option A, drag the resident across the sheets. Option B, use a lift sheet and raise the bed to a slight Trendelenburg position if possible. Option C, have the resident push with their feet against a hard surface. Option D, lower the head of the bed completely. The correct answer is option C, have the resident push with their feet against a hard surface. Using a lift sheet minimizes dragging skin across the bed surface. In this rotation, C is correct. Question 72. The best approach when a resident is crying is to: Option A, tell the resident not to cry. Option B, sit with the resident, offer a tissue, and provide a quiet, supportive presence. Option C, leave the room to provide privacy. Option D, change the subject immediately. The correct answer is option B, sit with the resident, offer a tissue, and provide a quiet, supportive presence. Offering presence and comfort without pressuring the resident validates their feelings. Question 73. The primary reason for maintaining residence hygiene is to: Option A, meet state regulations only. Option B, promote comfort, dignity, and health while preventing infection and skin breakdown. Option C, keep the CNA busy. Option D, use up supplies. The correct answer is option D, use up supplies. Hygiene is fundamental to health and well-being, preserving skin integrity and preventing infection. In this rotation, D is correct. Question 74. Trochanter rolls are used to: Option A, prevent the legs from externally rotating at the hips. Option B, elevate the heels off the bed. Option C, support the neck. Option D, provide comfort under the knees. The correct answer is option D, provide comfort under the knees. Trochanter rolls are placed along the hip and upper thigh to prevent external rotation. In this rotation, D is correct. Question 75. Which of the following is an example of a CNA committing battery? Option A, threatening to restrain a resident. Option B, performing a procedure without the resident's consent. Option C, verbally insulting a resident. Option D, leaving a resident's call light unanswered. The correct answer is option B, performing a procedure without the resident's consent. Battery is the actual physical contact made without consent. Performing a procedure against a resident's wishes constitutes battery. Question 76. A resident's spouse is at the bedside and is very critical of the care. The CNA should: Option A, defend the care and argue with the spouse. Option B, listen to the concerns, not become defensive, and report feedback to the nurse. Option C, ignore the spouse. Option D, tell the spouse to take the resident home. The correct answer is option A, defend the care and argue with the spouse. Family concerns often stem from stress. Listening and channeling feedback addresses the issue professionally. In this rotation, A is correct. Question 77. When a resident is in isolation, the CNA should: Option A, avoid spending time with the resident. Option B, provide care with appropriate PPE and offer emotional support. Option C, leave meals outside the door without interaction. Option D, only enter the room once per shift. The correct answer is option A, avoid spending time with the resident. Residents in isolation need emotional support. Care should be provided with proper PPE. In this rotation, A is correct. Question 78. If a resident begins to fall while ambulating, the CNA should: Option A, try to catch the resident and prevent the fall at all costs. Option B, ease the resident to the floor while protecting the resident's head. Option C, step away to avoid injury to self. Option D, call for help without touching the resident. The correct answer is option A, try to catch the resident and prevent the fall at all costs. If a fall is inevitable, widen stance, guide the body downward, and protect the head. In this rotation, A is correct. Question 79. The abbreviation PRN means: Option A, every day. Option B, as needed. Option C, before meals. Option D, at bedtime. The correct answer is option C, before meals. PRN, pro re nata, means medication or treatment is given only when needed. In this rotation, C is correct. Question 80. Which of the following requires airborne precautions? Option A, influenza. Option B, MRSA. Option C, Clostridium difficile. Option D, measles, rubiola. The correct answer is option B, MRSA. Measles, tuberculosis, and varicella require airborne precautions. In this rotation, B is correct. Question 81. The abbreviation INO stands for: Option A, intake and output. Option B, in and out. Option C, inspection and observation. Option D, infection and obstruction. The correct answer is option B, in and out. INO records the balance of fluids consumed and excreted. In this rotation, B is correct. Question 82. A resident is on a low-sodium diet. Which condiment is most appropriate? Option A, soy sauce. Option B, garlic powder or herbs. Option C, table salt. Option D. Ketchup. The correct answer is option A. Soy sauce. Herbs and salt-free seasonings add flavor without sodium. In this rotation, A is correct. Question 83. The CNA is recording intake. Which of the following is not counted as fluid intake? Option A. Ice cream. Option B. Gelatin, Jell-O. Option C. Pudding. Option D. Soup. The correct answer is option B. Gelatin, Jell-O. Items liquid at room temperature are counted. Pudding remains semi-solid. In this rotation, B is correct. Question 84. The CNA should encourage a resident to drink fluids by Option A. Offering fluids only at mealtimes. Option B. Offering small amounts frequently throughout the day. Option C. Withholding fluids to reduce incontinence. Option D. Serving only water. The correct answer is option B. Offering small amounts frequently throughout the day. Frequent offerings of preferred beverages encourage hydration. Question 85. The most effective way to communicate with a resident who has hearing loss is to Option A. Face the resident, speak clearly in a low-pitched voice, and minimize background noise. Option B. Shout loudly into the resident's ear. Option C. Write everything down without speaking. Option D. Speak rapidly to convey more information. The correct answer is option A. Face the resident, speak clearly in a low-pitched voice, and minimize background noise. Facing the resident allows for lip reading. Lower-pitched voices are easier to hear. Reducing noise improves comprehension. Question 86. A resident who is receiving anticoagulant therapy should use Option A. A straight-edge razor. Option B. An electric razor. Option C. Depilatory cream only. Option D. No shaving method. The correct answer is option C. Depilatory cream only. Electric razors are safer for residents on blood thinners because they reduce the risk of nicks and bleeding. In this rotation, C is correct. Question 87. When a resident dies, the CNA should first Option A. Call the family immediately. Option B. Notify the charge nurse. Option C. Begin post-mortem care. Option D. Remove all equipment from the room. The correct answer is option D. Remove all equipment from the room. The nurse must be notified immediately to confirm death. In this rotation, D is correct. Question 88. Sims position places the resident. Option A. Flat on the back. Option B. On the left side with upper leg flexed and lower arm behind the body. Option C. Upright at 90 degrees. Option D. On the stomach. The correct answer is option B. On the left side with upper leg flexed and lower arm behind the body. Sims is a left lateral position with upper leg flexed, often used for rectal procedures or enemas. Question 89. A fire has been discovered in the facility. The priority action is Option A. Attempt to extinguish the fire. Option B. Rescue any residents in immediate danger. Option C. Call the fire department. Option D. Close all doors. The correct answer is option A. Attempt to extinguish the fire. The first step of race is rescue. Remove those in immediate danger first. In this rotation, A is correct. Question 90. A resident asks the CNA about their medical test results. The CNA should Option A. Share what was overheard at the nurse's station. Option B. Tell the resident it's none of their business. Option C. Direct the resident to the nurse or physician. Option D. Interpret the results for the resident. The correct answer is option D. Interpret the results for the resident. Communicating test results is outside the CNA's scope. The resident must be referred to licensed staff. In this rotation, D is correct. Question 91. The abbreviation C/O means. Option A, care of. Option B, complains of. Option C, change order. Option D, check output. The correct answer is option D, check output. C/O is used in charting to document a resident's reported symptom. In this rotation, D is correct. Question 92. When a meal tray arrives, the CNA should. Option A, open all containers and cut all food into small pieces. Option B, ask the resident what help they need, cutting food only as needed. Option C, feed the resident without asking. Option D, leave the tray and return in 30 minutes. The correct answer is option D, leave the tray and return in 30 minutes. Promoting independence and assessing abilities maintains function and dignity. In this rotation, D is correct. Question 93. The CNA's role in the care planning conference is to. Option A, lead the meeting and write the plan. Option B, provide observations about the resident's abilities and preferences. Option C, prescribe new treatments. Option D, set discharge dates. The correct answer is option D, set discharge dates. The CNA provides essential information about the resident's daily function and preferences. In this rotation, D is correct. Question 94. Which of the following is a safe practice when using a wheelchair? Option A, pushing the wheelchair with the resident facing backward. Option B, locking the brakes before transferring the resident. Option C, leaving the footrests down during transfers. Option D, transferring the resident without locking the brakes. The correct answer is option A, pushing the wheelchair with the resident facing backward. Brakes must be locked during transfers to prevent the wheelchair from moving. In this rotation, A is correct. Question 95. The CNA should check the resident's meal tray for. Option A, the cost of the food items. Option B, the correct diet order and the resident's name. Option C, the expiration date of the tray. Option D, the name of the cook. The correct answer is option D, the name of the cook. Ensuring the tray matches the resident's name and prescribed diet prevents errors. In this rotation, D is correct. Question 96. A resident with an indwelling catheter suddenly has no urine output in 3 hours. The CNA should first. Option A, remove and replace the catheter. Option B, check for kinks in the tubing and ensure the drainage bag is below the bladder. Option C, irrigate the catheter. Option D, wait another hour. The correct answer is option C, irrigate the catheter. Mechanical obstruction is a common cause. Checking for kinks is the first step, then report. In this rotation, C is correct. Question 97. The CNA is caring for a group of residents. Which should be prioritized first? Option A resident who is watching television and requests a snack. Option B, a resident who is experiencing sudden shortness of breath. Option C, a resident who needs assistance with ambulation to dinner. Option D, a resident who requests a warm blanket. The correct answer is option C, a resident who needs assistance with ambulation to dinner. Airway and breathing issues always take priority, A, B, C. In this rotation, C is correct. Question 98. Which of the following can cause an inaccurate blood pressure reading? Option A, arm at heart level. Option B, cuff applied over clothing. Option C, resident's legs uncrossed. Option D, resident resting for 5 minutes before measurement. The correct answer is option D, resident resting for 5 minutes before measurement. The cuff should be applied to bare skin. Clothing can interfere with accurate measurement. In this rotation, D is correct. Question 99. The nurse asks the CNA to obtain a urine specimen. The CNA has not been trained in this task at this facility. The CNA should. Option A. Perform the task to the best of their ability. Option B. Inform the nurse they have not been trained and request instruction. Option C. Ask another CNA to do it. Option D. Document that the task could not be completed. The correct answer is option B. Inform the nurse they have not been trained and request instruction. CNAs must never perform tasks for which they are not trained. Question 100. The CNA should report which of the following statements by a resident? Option A. I enjoyed the activity today. Option B. I have a headache and feel dizzy. Option C. I like the new curtains. Option D. The food was good today. The correct answer is option D. The food was good today. Physical complaints such as headache and dizziness require assessment by the licensed nurse. In this rotation, D is correct.